So, okay, thank you everyone, and thank you so much, Dr. Sean. Probably this is my last semester at Mississippi State, and this is going to be my last presentation. So kind of bit emotional, but uh, thank you again because I learned so many things from Dr. Sean. And so my project title is analyzing the post-vaccination heart attack using machine learning. So let me introduce myself. This is Elias. I'm a graduate student at Mississippi State. So today I'm gonna demonstrate the project that I have done throughout the semester. So let's get started. So the project is about how to analyze the post-vaccination data using the machine learning. So as you guys know that one of the most controversial disease is called to be cardiovascular disease. So that is leading to many kind of deaths. So it is very essential to analyze those diseases and to come up with some insights like what is going on and how healthcare professionals can take some decision to come up with any kind of preventable solution. So what happened is like COVID-19 period, like people was more focused on how to develop models to prevent the COVID-19 disease. But what happened after the COVID-19? So as you know, like we had to take a lot of doses when COVID-19 appeared. So probably people took like first dose, second dose, and third doses. So the scientists actually had the consideration like whether taking that doses had any kind of partial effect, or after the COVID-19, like is there any particular reasons or particular symptoms that actually causes the cardiovascular diseases. So my main objective was to analyze the data in terms of the cardiovascular risk. So let me talk about the motivation. As I said, the first motivation was address anecdotal reports. So which means like people say something about like any disease that is happening or any kind of causes is happening, but how much trust we can rely on that. So based on those considerations, like I have collected the data, and I was trying to do some exploratory data analysis and kind of scientific evidence, like whether people is saying anything about facts and those facts actually is valid. So the next motivation was empirically assess the vaccination heart attack link. As I said, like it is very difficult to measure about any kind of problem if we are not looking over the particular insight that is happening inside the data or any facts that the people is talking about. So the next motivation was like since the problem was associated to the healthcare driven, so whether or not I can come up with something that can be very suitable for the healthcare professionals. So the doctors, they can take any decision to prevent the outline disease that I mentioned. So let me talk about the gaps and contribution. So based on the past research that is happening, so the people actually focused on post-infection, but what about the post-vaccination? Because vaccination is also very important. So infection is leading to some kind of facts, but once it comes to the vaccination, then it might be associating with some kind of particular doses, or people take AstraZeneca or like Pfizer, or that kind of vaccination is available. So maybe this is very important to analyze those vaccination. And also the limited ML integration, as much as the paper that I looked over, it is more statistical driven. Like statistical driven means they are analyzing those data more statistical way, but maybe integrating ML could be more valid, because in the future pandemic we don't know like how many people will be affected. So machine learning has the possibility to analyze the vast amount of the data. You could say like billion or trillion amounts of the data that machine learning can analyze. So maybe we can integrate the machine learning to analyze those facts as well. And also the feature consideration that is also missing in the past research. Feature consideration means like once we are building any predictive models, so we don't need actually the entire features to run a model, right? So what happens like you have 100 features, those are the leading the particular date. So we might not the 100 features to run a model. So that's why like the feature consideration is very important. Like once it comes to the healthcare prevention or healthcare monitoring, then we might need to understand like actual parameters, those are the responsible for leading a death or leading any causes. So my contribution actually encompasses like I have taken a data set which is real world data, and I analyzed the vaccination and the health features as well. Then I also did some a little bit exploratory data analysis to before modeling, because those help me to take the decision and to come up with selecting the models. And also I emphasize the post-vaccine surveillance with data-driven methods. Let me talk about the dataset overview. These datasets actually I collected from the Kaggle. You know, Kaggle is the online data repository which is worldwide accessible. And the data is about Indian patients, so more than 550 individuals from India. And the features was age, gender, and the vaccine information, some kind of health matrices. So my target was to predict the heart attack occurrence from the data. So let me talk about the data cleaning and the feature engineering. This is very significant part of any kind of machine learning models, because data actually is coming from the real life, or kind of you could say any kind of online repositories or somewhere else. So the data might be consisting of a lot of missing variables, inconsistent features. So those are not required to run a machine learning model, or the model will be biased if we are not cleaning the data properly. So I have taken those things into my consideration. So I cleared up all kind of missing or inconsistent variables from my data set. Secondly, I create a heart attack binary level, because as I said, the data was not properly annotated. It was kind of consisting with some text and other information. So I had to come up with decision like how to create the target level. And also I have normalized the continuous features from my data set. So those help me to run a scalable machine learning models. So the outlier detection and EDA part, regarding the outlier detection, I use the G-score, and for the EDA, I focused on the age, vaccine dose, BMI, and cholesterol. And to give you more ideas, like outlier is something that is variable which is not related to their associated parameters, and those values actually, that is not a problem at all, but sometimes in case of running a model, it does cause a problem, kind of overfitting or misleading information. So it is better to not to keep the variables and to filter out before applying ML model. So let me show you some exploratory data analysis that I have done. So if you look over the left side, the age-related data, so you could see like the heart attack causes increasingly about ages 40%, like people whoever got 40 ages, so they got more like, you know, heart attack as well. And turning into the older adults like 50 to 70, so like they have shown like higher heart attack performance. If you can look over the second figure, you could see the difference between the vaccination dose and other proportion. So we can observe that the heart attack rates are kind of similar across all vaccine doses. And we can also observe that no significant difference between first, second, and other kind of booster doses as well. So this is another exploratory data analysis. So here I have done with, you know, BMI distribution by heart attack status, and also cholesterol level distribution by heart attack status. So in the left side, the left figure, we can see like the BMI distribution is similar for both heart attack and non-heart attack groups. And also we can see the slightly higher median BMI observed in case of the heart attack cases. So turning into the right side figure, the cholesterol level comparison, we can see that the heart attack occurs across a wide range of the cholesterol levels. And also we can see that no clear cholesterol threshold is strongly separate that heart attack and non-heart attack groups. So the final remarks, we can see that the heart attack actually occurs when the person got 40 or 40 years, above 40 years of old, and no dose-specific cardiac risk that I found from the after the exploratory data analysis, and also the BMI and the cholesterol linked to heart attack risk. So this is the feature importance part, and as I say, the feature importance is very important before building any kind of models. So I did a quick feature importance analysis throughout the data, and I have extracted that the top features was BMI, then cholesterol, and then ACE. Those are strongly associated with the diseases as well, and I can say that the moderate level features was like pre-existing conditions and blood pressure. So like those are kind of moderate. So and I excluded the other features from the analysis part as well. So those are the models that I considered during developing the models, like the logistic regression, decision tree, SBM, naive Bayes, KNN, and XGBoost. Although different kind of models could be utilized, but I did not have consideration applying very state-of-the-art models, because my primary focus was to investigate actually the causes that are responsible for the cardiovascular diseases, and a little bit come up with some models that can be a roadmap for the future healthcare professionals. So whoever can take the guidance from my approach, and they can integrate their pathways as well. So regarding the model performance, I can say that HDM and the naive Bayes was kind of good, but that not good at all, because the data set does have some problems, and due to the time constraints, I wasn't able to make the data more scalable. So then next, the KNN was appeared to be around 70% of accuracy. But the logistic regression and the decision tree, those didn't give me the good performance at all. But I expected that like they will be providing with some robust performance, but they didn't. So now let me talk about the critical observations. So I have found that like age, BMI, cholesterol, so those were strong key predictors that are responsible for the cardiovascular diseases, and vaccine dose, it wasn't a major detriment. So like we cannot say like whether or not a person have taken a vaccine dose or not, so that might have the cardiovascular risk. So, and also importance of the multi-features modeling. Multi-features modeling is nothing but like we have a target outcome, and we have many more variables that are associated strongly with the particular diseases. Talking about the project limitations, frankly speaking, I had so many limitations, like starting from the class imbalance, then some kind of incomplete data, and then lack of longitudinal tracking, and also the limited geographic people. Because the data set was too small, and it was very hard for me to come up with some data annotation as well, and also discard some variables, because if I would have some lot of data, then I could easily discard some parameters. Those are not very important, and also I could enhance the data by utilizing kind of synthetic or augmenting the data using kind of advanced features of the LLM. But since this data was strongly associated with the healthcare, so I didn't move on to take that decision. So I just did whatever I had the scope. So to conclude, ML predicts cardiac risk post-vaccination, and the strong prediction throughout the process was BMI, cholesterol, and age as well. And the vaccine dose it was not related to the heart attack risk. So it was all about my insights and presentation. So if you have any questions, then do let me know.